Hey, thanks for visiting us at loptonline.com. I'm Jake Denell, one of the physical therapists at Lincoln Orthopedic Physical Therapy. So glad you could join me for this. Today's lesson is going to be on foam roll exercises. You've seen these at Shields, you've seen these at Shopco, you've seen these in sporting goods stores, and you say, how do I use these and what are they used most for? Well, in my practice, they're used for two primary things. The first one is for range of motion of the shoulder, and the second one is to improve posture. So both these things the foam roll is excellent for. And with me, we're lucky enough to have a professional model, Josh Ostro, student. So Josh is going to help demonstrate these for us. He is a pitcher, so he has a little more flexibility than most of us do. So don't be discouraged by that when you say, man, he really moves a lot more than I can. But it's a good model for you to follow. So the first thing we're going to try to do is improve your posture. So if Josh, could you come over here and sit right here in this chair? And a lot of us have what we call academic posture. We kind of slump down. We have a kind of an increased curve here, what we call a forward head posture. And this part here, and have neck pain and upper back pain from being at a laptop too much, or hunched over reading a book too much, or a number of reasons that have gone in our society, and we don't have really good extension. And we know bad posture is bad for your shoulders, and it's really, really bad for your upper back and neck. So these foam roll is designed to take care of that. So I'm going to move this chair away, have Josh sit up here. And Josh has done these exercises several times. He does a great job. You place the foam roll on the floor like so, and then Josh, show him how you get on that, okay? He's going to sit right at the end, and he's going to make sure that his head is all supported on there, okay? Now, some of you that have a forward head posture, that's going to pull just a little bit too much. So what I would do in that case is I just put a small pillow in there to support that lordosis right in your neck, right there, that little inward curve. Josh doesn't have that problem, so I'm going to take that pillow out, okay? And the first exercise then is just to lay on there for 30 seconds. Now all these exercises are available at our website. All you have to do is go to it, send a request at loptonline.com, and we will email you a copy of these exercises, hard copy too, besides this video. We're glad to do that for you. The first exercise that we're going to do then, as he's laid here for 30 seconds, is just bring his arms up into what we call the Y position. That's right here, like this. And a lot of times what we'll see is just laying like that is really good. Stretches this whole front area, your whole sternum, your pectoralis major, your pectoralis minor, and these biceps tendons, latissimus dorsi tendon, and sort of just flattens everything out and really gains range of motion. Now Josh easily touches the floor. Most of us won't be able to do that, okay? We're just not able to have that type of flexibility. But when you're a college pitcher like he was, one thing is you have excessive range of motion. The second position we're going to go to then is what we call the abducted position, okay? And right there you see Josh kind of laying out to the side. What I've done is I've just placed some small hand weights on his hand. And basically, that's just to give it a little extra stretch. And so what we're going to do here, that's position 2, again for 30 to 45 seconds. Position 3 will be external rotation. His elbow is down at 90 degrees. This stretch is what we call your subscapularis. It's a muscle of the rotator cuff. It's a great stretch again, right here as he's fully externally rotated and in that position right there. Again, he'd hold that for 30 seconds. So that's our static stretches we have for that. Static means it doesn't move. Next, Josh, what we're going to do is, of course, the dynamic stretches. So with the small hand weights, Josh is using 2 pounds. His arms are going to go straight like this, and he's just going to do a Y like this, about 15 times, all the way down to the floor and back, and alternate his hands, one over the other. Just like that. Great. Good. And I like the rate that Josh is doing this. It's slow and controlled. And that's about how fast you should be doing it at home. Slow and controlled and easy. And it's just a Y or a 10 o'clock and 2 o'clock position. This, if you have rotator cuff surgery or if you've got shoulder impingement pain, are excellent soft tissue stretches which will really stretch you out. And you'll notice the more you do this, you'll instantly gain a lot of range of motion or movement in your shoulder joints. It's one of the very best things. And you know, Josh is at 9 reps right now, and I think we'll just stop there because we don't want to be overly redundant. And then Josh, let's go down to 9 and 3 o'clock, please, and we'll do crisscross one over the other. Go ahead and bring it across. Yeah, way across and adduct it. Yeah, good. And then all the way down to the floor. Excellent. Alternating one hand over the other. Excellent. Good. And again, about 15 of those, slow and controlled, as Josh is demonstrating. It looks absolutely really good. This again stretches the posterior deltoid muscles, the shoulders, the back of the shoulder, and really does a nice job with your pecs, your pectoralis major, and right there. Okay? Then the next one we're going to do is the most difficult motion to get a lot of times with your rotator cuff is what we call full flexion. So we're going to do the swim. One arm up and one arm down, and you'll see how Josh does this. And again, he does it slow and controlled, and this looks excellent. It looks really good. And at the end, he just stretches it down, just like this. And this exercise looks easy on Josh. It's hard on most of us. And it really, really pulls a lot. And again, just like anything else, we want to stretch softly. We're working with tight tissues, so you want to stretch it slow and easy. If 10 is a severe, severe stretch and 0 is no stretch, just about a 5. And just go back nice and slow like that. And Josh is doing it right at the right rate. Now I'm going to take you back to your youth. Remember when you used to do angels in the snow? Way back when you're a young person, make that, we call that abduction. And we're going to really work at stretching. You can come around all the way up to the top, clink those weights, and then back down, just like that. That's perfect, Josh. That looks really good. And you try to keep your hands as low as you can on this. They're not going to be able to stay on the carpeting or the floor, but that looks really good. Again, 15 reps is good, and about that rate. And slow and controlled, just like that. That looks really, really good. So you get the idea there. That's called like snow angel. Then the next one, what we're going to do is a bench press. And what we're going to do, we're come way back here. You'll see that sometimes your pec tendons right in here are really tight. It's hard to get them down to the floor. And you're just going to do like a bench press, just like that, coming all the way back, stretching that back, just like that. And again, this one, slow and controlled. This one you might do a few more, maybe 20, 25, because the motion is so small. But when you come back here where it's tight, you want to hold it. You want to make sure your elbow is not down here, like into your side, or too far up. It should be right straight in line, as you see here with Josh, with his shoulder and elbow in a straight line. Okay, Josh, let's do about 5 more of those. And nice full extension, that looks good, nice control, just like that, okay? So we've kind of got that covered now as you've done that. And then the last one we're going to do is you're going to put your arms down straight, and just you're going to try to shorten, believe it or not, like reach for your toes, just like that, or your heels with the weight, and hold it for about a count of 5, and then relax. And that's to stretch your upper traps, just like that. So he's going to do a little what we call scapular depression, and you can see as he does that. And he'll do about 5 of those for 5 counts. And that finishes the foam roll exercise. Now you say, well, has that helped my posture or not? And so as I will show you how to get off that. Would you hand me the weights then, Josh? So when you get off the foam roll, there's a way to get off that. So if you just gently roll, like so, and let the roll come out from underneath you, and then lay flat, you'll say, whoa, am I stretched out? Your spine feels a lot straighter. The lordosis in your lower back and your neck has really come down and relaxed. And you'll see that's a really, really good stretch for your shoulders and your posture. You probably can't do anything better than that for those 2 problems. So Josh, and then show them how to get up from the floor. Turn on your side, please, and then push up, and then stand up. Okay? Very good. Thank you, Josh, and thank you for attending again. Lincoln Orthopedic Physical Therapy. And if you want these exercises on paper too, besides the video, visit our website. It's on the screen. Thanks again for coming. for watching.